Two types of diabetes. It is suggested in the medical community that there are two types of diabetes, type 1, or insulin-dependent diabetes mellitus, IDDM. Diabetes type 1 accounts for about 5 to 10% of all cases of this disease. A person suffering from this type of diabetes requires type 1 diabetes results from insufficient insulin production by the pancreas. It has been estimated that there are over 24 million people in the United States and over 3 million in Canada are affected by some. Diabetes is ranked 7th as the leading cause of death in the U.S., although the lifespan of patients with diabetes has increased due to improved methods of detection and better The medical community, as usual, suggests that there is no cure for diabetes at the present time. My experience has proved. I continue to emphasize that the mind-body is capable of healing itself when it is provided with the recipe for healing. Type 2, or non-insulin, occurs in the remaining 95% of the diabetic population. Type 2 diabetes is believed to be related to an imbalance of insulin secretion, such as insufficient quantity or delayed response. Type 2 diabetes results from the failure of the mind-body to effectively metabolize glucose, is needed to stimulate the beta cells in the pancreas to release insulin into the bloodstream. Insulin helps in the transporting of glucose from the blood into the storage of liver and muscle cells. From there, it is released into the bloodstream. The brain needs glucose for energy. However, if there is a failure of the pancreas to efficiently produce the amount of insulin needed, or if there is a failure in the mechanism of transporting glucose to the cells, insulin. It is suggested by healthcare providers that NIDDM has a tendency to develop later in life. However, this could be misleading, because either type 1 or type 2 diabetes can occur in the very young or very elderly. I was diagnosed as having diabetes at the age of 26 years old. It is because of God's healing power of love I am no longer diabetic. When I was a diabetic, to control my blood sugar level, I had to go to the clinic for an insulin shot every day. Technology was not as advanced in the 1960s as it is. It was a very frustrating and a difficult experience for me because I had to work, and time was a factor. My faith was. I went to the only source I believed could help me in my time of desperate need. One morning after leaving the clinic, I went into my bedroom and prayed. I asked God for healing. I finished my prayer by saying, "Thank you, Lord. I will never go back to the clinic for insulin." I have not been back since that day. When I prayed that special prayer, I reestablished and re-energized the process of God's creative power of dynamic energy, vitality. The miracle of healing reinforced my faith, confidence, and belief in my continued journey of life, knowing that my destination is secured in my Creator's love. Matthew, a cancer/stroke patient whose Ph.D. was obtained, asks you to help him raise awareness of health issues by sharing this valuable information. Please take the time to subscribe to and like this video.